All right. Well, I'll go ahead and get started. My name is Tulika Singh, and I'm the state captain in North Carolina with Right to Health Action. We're here today because of the COVID-19 pandemic, which is devastating poor and marginalized people in the US, across the globe, and disproportionately affecting people of color. I'm sad to say that the death toll is more than 500,000 as of just yesterday in the US alone, and across the world has surpassed more than 2.5 million people. So we're here to learn today how to take action in response to this pandemic and work to prevent pandemics of the future. To start us off, we invited one of our team members, Sharla Adenikin, to share her story on why we so badly need a pandemic prevention plan. So I'll go ahead and pass it off to Sharla because she's going to help us explain to us why we need to fight for these policies that invest in public health workforce, environmental health, and global health and racial justice. Thanks for joining us, Sharla.
Thank you so much. My name is Sharla, and I am a social justice documentarian by trade. The impact of COVID on my life has been personally devastating. I've lost 5 people that I love to it. My best friend, my friend lost her husband, who was young, and he was a triathlete, and he left behind 3 young children within 3 days of when he was first diagnosed. I also lost another friend who had diabetes prior to COVID, and that has been extremely hard to imagine him not around. You're just never prepared to see people you love pass within a few days, going from, being healthy to no longer alive. It really is devastating. Additionally, while dealing with my grief, I had to also make really important life and death decisions. My best friend, her husband is a healthcare hero. He is an emergency room physician's assistant at Lenox Hill, which was the epicenter of the New York City outbreak. The stories from him were ones that you just hear from, from a war front. His supervisor made national headlines because she committed suicide due to the devastation she couldn't stop thinking about. I was in Portland visiting my son at the time, and due to his and my best friend's guidance, I decided to stay there, to stay here with my former abuser. I had to make a choice between risking my life to go back to the epicenter of the virus or risking my life in a different way and staying in Portland and depending on my ex to keep me safe. This is a decision that a lot of women and just people in unhealthy relationships have had to make during the pandemic, because there's so few resources for help. And also for me personally, with the loss of work, it really took away my independence during the lockdown. And being so far away from home on the other side of the country has just left me in a vulnerable position, because while I had been here, patterns of domestic violence have reemerged. I often last year felt trapped, and until very recently, I started to regain my footing again. I really believe that our society needs a safety net, especially during this time, during the lockdown period. We had nothing last year during the lockdown. There was no safety net for vulnerable populations like myself, especially with everything being in limbo. So this is why this administration must have a game plan that includes members of societies who are in these vulnerable positions. Right now, I feel very fortunate that I have been able to work my way out of this situation, but for so many others, they aren't as lucky, and many unfortunately have died because of the lack of access to critical social services. So thank you so much for giving me this time. And for me, this is one of the most important reasons why we must push Congress to push through the People's Pandemic Prevention Plan.
Wow, Charlotte, I'm so sorry to hear the stuff that you've been going through recently. And thank you so much for sharing your powerful story with us. You're right. There are so many others who are vulnerable by this pandemic or dead. And that's why we must act now to enact policies that will protect us all. We can't let this business as usual cycle of neglect and outbreak and then again neglect go on. We have to stop this cycle, especially when we know that our suffering and our loss is preventable. Our upcoming keynote speaker is here to share what happens if we don't disrupt this vicious cycle. I'm honored to introduce Kristin Urquiza. Kristin is the Deputy Director at Mighty Earth and oversees their oceans and sustainable rubber practices. However, more recently, she also is the co-founder of Marked by COVID. This is a grassroots movement for people who've lost loved ones to this pandemic that should have never have happened. Kristin grew up in Phoenix. She's the proud product of primary public education and the first person in her family to go to college at Yale. Her grandparents were migrant farm workers from Mexico and Oklahoma, and her father worked in the fields as a child. Unfortunately, last June, her parents contracted COVID-19. They became ill because Donald Trump and Arizona Governor Doug Ducey downplayed the severity of the coronavirus. Her father, who was a healthy man, previously a healthy man, unfortunately died on June 30th. With the help of friends and family, she wrote the first honest obituary. She invited the governor to her dad's funeral and held a vigil at the state capitol. She then bravely launched Marked by COVID to honor her father and was invited by President Joe Biden to address the Democratic National Convention, where she gave one of the most powerful speeches of the week. With her team at Marked by COVID, Kristin elevates the stories of people who have been impacted by COVID-19 in order to enact bold changes in policy and hold policymakers accountable for negligence that has contributed to more than 2.5 million deaths worldwide. They're organizing to win systemic policy changes that we need to transform our world beyond COVID-19 and make sure that this nightmare never happens again. With that, I'll hand it off to Kristin. Thank you so much for being here tonight.
Thank you so much for having me. And it's so great to see everybody who is here at this really important gathering. I even noticed some familiar faces, and it's really great to see you here. So as I was introduced, my name is Kristin Urquiza. I'm the co-founder of Marked by COVID. You heard a little bit about my story. One of the things that I've been up to over the course of the last 6.5, 7 months since my father passed is really working with people who have been just like me, impacted by this virus in really extreme ways, having lost a loved one, have been a survivor, are experiencing long-term health impacts, and who want to do more to ensure that this never happens again. Our ongoing partnership with Right to Health Action has been central to really developing my knowledge in the healthcare space even further, but also the People's Pandemic Prevention Plan not only works to ensure that there is a equitable and just response right here and right now and to set us up, but to set us up for preventing pandemics for the future. It's not going to be 100 years before there's another pandemic. We are in jeopardy of it not being 100 years, I guess I should say. At any rate, there will be another huge public health crisis. And what this pandemic has really exposed is for many people to see for the very first time the systemic inequities that have existed in our healthcare system, that have it resulted in disparities in outcomes from not only more folks who are people of color, Black, Indigenous, Latinx, and others getting dying from this disease, but also exposing how we as a society do not prioritize people who are living in nursing homes, people who are already living with other abilities. This is the moment for us to really think about public health in an entirely different way. And my experience with the loss of my father has definitely changed my entire life. As you were all introduced to, prior to this happening to me, I had worked for about 15 years in the advocacy space. It wasn't totally foreign to me to be able to, stand up and speak on an issue that I cared about. That advocacy space that I worked in was in the climate crisis, in protecting the environment for a healthy planet and healthy people. That work was most recently around stopping deforestation, as a mechanism to not only stop climate change and protect the lands of Indigenous people, but to also stop pandemics from happening. The confluence of deforestation work and losing my father to COVID, and since my father's death, having lost 4 more people in my family to coronavirus, it has become abundantly clear that these issues, they can no longer be siloed. They are interconnected. And at the center of it is health. It is our health. It's the health of our communities. It's the health of people whose names we will never know, whose children we will never meet. We are all in this together. And so part of what Marked by COVID is doing in our work and our advocacy alongside Right to Health is making sure that the people who have been most impacted, that those needs are centered in the ongoing and permanent response to the coronavirus pandemic. So we do not leave people behind who don't have access to health insurance and have long-term health impacts, that we don't leave behind the children who have been orphaned because both of their parents have been taken by this. This is a bold and ambitious plan, but it's the plan that we need, and it's the plan that we deserve. I was very honored over the course of the last month to work with Right to Health to write a letter to the Biden administration, and we had the support of many of you probably in this room and folks all across the country to bring to attention the urgent need for prevention in our plan. And while I'm grateful that the Biden administration has a return to science and has prioritized COVID in executive orders, we still don't have enough. One of the things that I am particularly impassioned about, which is in this letter, in the Right to Health platform, and in the Marked by COVID platform, is stopping pandemics from happening again. And I touched on this a moment ago with mentioning deforestation, whether it was coronavirus or HIV or other diseases out there that have struck us over the course of the last several decades. Many of those are thought to have come from what's called the zoonotic transfer of disease. It's where human life encroaches upon the natural world and disease jumps from an animal host to a human host, or to an animal host to an intermediary to a human host. This is a huge problem right now going forward. We are losing our tropical rainforests at an unprecedented rate. This is because of the commodities that are being taken out of the rainforest, but also it's because people who once lived in these places, the local people, the indigenous people, the folks who've been, stewards of these areas, We've recently learned that many of them are shouldering healthcare costs that they cannot afford. So we're seeing once again health being an issue that is driving this cycle of viciousness that is resulting in people being oppressed and people dying. So in conclusion, the thing that I have learned over the course of the last half a year as I've become more of a public health advocate than an environmental advocate is that really at the end of the day, I'm a human advocate. I want us all to be able to live in a world in which we have access to things like clean air, clean water, but also care. I want to be able to pass that on to future generations and to apply the camper's rules, to leave this place better than I received it. That is what we're doing right now, working to make sure that this home that we have in one another is left in a better and decent place. And we have an uphill battle, but we are not alone. The thing that has been time and again balm to nourish my battered soul is people like you, sharing your stories, being vulnerable with the struggle that you are in, and still saying, I'm worth it, and we are worth it, and we deserve better. So with that, I will say thank you so much for being here and for dedicating yourself to making this world a better place. It is making a difference.
Wow, that was really a powerful statement. Thank you so much, Kristin. And thank you so much for bravely leading the systemic change that we urgently need today. Your work is just really inspiring, and it's great to be here with amazing leaders like you. Thank you so much for being here. In fact, I joined the fight for the same reasons, actually. Last October, I lost my grandmother to COVID. She was in the hospital for 19 agonizing days when they put her on the ventilator, and my heart just sank. The day after, I awoke to a world without my grandmother. You know, she's not coming back, and I miss her so much. You know, we keep dealing with this pain over and over and over again, and it haunts me that she was alone, away from her family in a crowded hospital, all alone. We could have been there for her. We should have been there for her. And it will continue this way with new emerging infectious diseases because we just won't know and we won't be able to be there for our family members. I think it also hurts because as a virologist and vaccinologist, I know that this could have been prevented. Just like you have come around to this, you know, this knowledge and gathering this information after this pain, like, yes, this could have been prevented. We can do something about this. And that's when I decided that I never want to feel this pain again. I don't want new emerging diseases putting my family at such a terrible risk. So that's what brought me to Right to Health. And this is a community that is fiercely committed to doing the hard work of fighting and winning policies that will make a difference in this pandemic and to curb future pandemics. We started out early in the pandemic lockdown. A group of friends got together. We were frustrated and tired of Trump's neglect that was killing our people. We knew it would be up to regular citizens like us to stand up and fight against the policies that maintain the status quo. We had to fight against the profound inequalities in who gets sick and who dies of COVID-19. So we decided to host these mass online gatherings, Right to Health Action, to be there for each other and to figure out from the experts what's causing this pandemic. What are the political and social structures that are making this so dangerous for us all? And what are the policy and political levers that we can push to change this and protect our communities? We hosted a dozen online webinars and events, brought together tens of thousands of people from across the country and the world. We talked about cross-cutting issues like the toxic web of unfettered capitalism, racism, and unequal risk, the role of climate change and deforestation and disease spillover from animals, the global vaccine apartheid that we are witnessing today, the need to revamp our public health systems and protect us in this time of need. One thing that was clear back then, and what is still clear now, is that the people were hungry for action. We didn't just want to talk about it, we wanted to do something. We wanted to make a change. And so we consulted with grassroots organizations, frontline health workers, scholars, COVID survivors, and families and communities, and we developed the People's Pandemic Prevention Plan. This is a package of policy strategies necessary to bring an end to this pandemic and prevent the next one. With this plan, we demand 4 things. We demand a massive new public health core in the US. We demand that vaccines are available to everybody. We demand global investments in healthcare and pandemic prevention in the top 500 sites for disease spillover around the world. And we demand programs to curb the corporate drivers of pandemics. This is what we're fighting for. So what's most remarkable is that we've done this with $0. No paid staff, no fancy consultants, no big grants, nothing. We've done this by digital shoe leather organizing, asking friends to join, building coalitions, fighting for what's right. Together, we've already accomplished so much in less than a year. More than 90,000 people across the country have supported the People's Pandemic Prevention Plan. We've led more than 500 meetings with members of Congress and their offices, and got thousands of first-time activists to have the courage to engage with their elected officials. Because of our efforts, Senator Elizabeth Warren and Representative Ro Khanna wrote a congressional sign-on letter based on this People's Pandemic Prevention Plan. And now powerful people are listening to us. We've got more than 141 members of Congress to support this letter. That is awesome. That is huge progress. With the House now, and the Senate and the White House in Democratic Party control, there is now finally a chance, a window of opportunity to pass the People's Pandemic Prevention Plan into law. While this is all amazing and we've accomplished so much, we have a long way to go to win these laws that we are fighting for. We need many, many more people working with us to demand our elected officials to support these life-saving policies. People power from people like me, people like you, my friends who joined this call for the first time, that's what's gotten us this far. And we need to continue to build this people power across all of our communities. This moment is crucial to winning policies. The next pandemic, like Kristin was saying, will not be 100 years away. Evidence shows it will likely be within the next decade. We can't afford inaction. We can't afford to keep dying from preventable pandemics. When my grandmother died, it was too late to prevent this catastrophe. I don't want to look back 10 years from now with new diseases knocking on our doors, wishing that I had done more today to protect my family. That's why we need to act now. I know from my loss that no one else will save us besides ourselves. So it's up to us to stand up and act. And I know this is a lot. This threat is real. And so thankfully with the team at Right to Health Action, we've broken this down into actions that you can take today to fuel this fight for our lives. And here is what we can do. Here are 4 actions that we can take today together. I'll walk through these actions with you. Action 1, you can sign a petition that sends a letter to Congress or the White House urging them to take action on our pandemic prevention plan. You can make your voices heard. We are making our voices heard here as well. You can attend a meeting with your member of Congress, with your local Right to Health Action team. We are active across so many states. And today you'll get to meet with your local team member at Right to Health Action. Action 3, join us. Join our core organizing team in fighting for these life-saving policies. Organizing is difficult, and we need all of your talent and passion on our team. Finally, we are hosting a fundraiser right now. We're an all volunteer grassroots team, so you can make a financial contribution to propel our movement. So who's with us? The link is about to be shared in, oh, there it is, in the chat. So go ahead, check out the link in the chat. This link will include actions that you can take today, just like the 4 actions I've mentioned today. And in that link, you can let us know how you would like to get involved and take action to fight with us to prevent pandemics. So yeah, it's really up to us. We hope you're as pumped as we are to get out there and fight for some real change. So thank you for coming to meet with us tonight. And I want to give a huge thank you to our speakers, Charla and Kristin. Thank you for coming coming to this meeting and joining us tonight. Also, thanks to all of you. I want to give you just a couple quick notes on what's coming up at Right to Health in the upcoming month with us, so that you can engage and join us in our upcoming events. Yes, there we go. Here's the slide. So up next, we are hosting a webinar on Wednesday, March 3rd at 8 p.m. Eastern Time and 5 p.m. Pacific Time. And this webinar is titled Investing in Communities, Building Trust and Public Health Resilience. We'll speak with various community-led public health programs to envision how national public health workforce can help local communities connect to the care they need to live healthy lives. Also, as this slide is showing you, after the webinar, or not after the webinar, what's happening right now is our fundraiser. So I want to take a moment to invite you to make a donation in support of our fight. We are 100% volunteer-run organization, and we need your help to take the next big step in hiring teams of people to drive this work forward and make our work sustainable. We work all day, we come back in the evenings, and we're here, trying to get these policies, trying to win these policies, but we also need more help to keep this movement sustainable and keep it growing and moving forward, to win the policies that we need to prevent another pandemic. So please consider contributing financially to Right to Health Action as well, and joining our fundraiser. The link to donate is on your screen, and also I'll share it on the chat in just a bit. Thank you for joining us in this fight. You can visit us at r2haction.org or email us at info@r2haction.org to learn more about our work or join our team. Thank you so much for your time tonight. Have a great evening. It was nice to meet you.